I was diagnosed with breast cancer pretty close to 1 year ago. I was 24 weeks pregnant with my third child. I was just really scared and worried, and I couldn't get through every evening reading books to my kids because I just kept thinking, I need to be here. Finding out that diagnosis was the worst day of my life.
Yeah.
That's just the best way I can describe it.
Yeah, rocks your world.
Yeah, yep, rocks your world.
So I was diagnosed with acute myeloid leukemia at the end of April in 2022. And because of my age, I'm 73 now, they cannot use the heavy-duty meds that might put it into remission. So it's more a matter of keeping you going as long as you can. And the good news is I was given 1.5 years to 2 years at that time, and I've already passed the 1.5 year mark. One of the things I've learned through this, when I meet gals like you, my heart really goes out to you. It looks way, way different when you're older. I've had a long, rich, full life. I don't feel like I'm being robbed of anything or anything like that, you know. I do pray for healing because I want to be here to take care of my wife and to be here for my kids and grandkids. So we're grateful for the life that we've had. We are grateful for our sons and grandkids and all of that, for the good life that we've had. Almost every night, Linda says, it's been another good day.
So I was diagnosed in September 2018. My pregnancy, honestly, besides having breast cancer, she was healthy the entire time and did really well. And she was born on May 21st of 2019 and was absolutely perfect. I finished my last treatment on May 21st of 2020, which was her first birthday to the day. That was, again, God's fingerprints all over that. And my daughter's going to kindergarten in August, and I'm gonna get to see her do that, and that's pretty amazing.
That's
and
amazing.
So, and she's healthy, and I'm healthy, and our family is very, very grateful for that. Why did you guys choose to work at St. Elizabeth?
As far as my job goes, I love my job. I love the patients. I love being part of their lives, hearing their stories, getting to interact with them on a daily basis. And, you know, St. Elizabeth allows that. They allow for time in my schedule. So if I'm too overbooked, I can kind of spread out my patient appointments, and they provide resources that I'm really glad I have.
I get up every morning and look forward just to the interactions during the day and the experiences and the people. As much as we give as caregivers, we receive twofold back.
100%. I mean, our patients become our families. We take a responsibility in our patients in their, well-being and making sure that they feel safe and they feel comfortable with us. And we love them.
It shows,
Yep.
you know. You guys talk about that you enjoy going there, and you guys, have like a good rapport with each other and just like family amongst each other, but then to the patients, I mean, I think we as patients pick up on that.
Yeah. And not only to the patients, but to the families as well. I know that my husband just felt so loved by you guys, because that was an incredibly hard situation for him, because cancer, I feel like, is very much a family diagnosis.
I was actually looking at the St. Elizabeth website, and then I saw the values, and I was looking at those, innovation, collaboration, accountability, respect, and excellence. I was just kind of looking at those words on the screen and thought, hey, that spells I care. That, I think, really captures my experience from the very beginning, from the front office staff to the doctor and NP to the nurses. You sense that I care is not just on the website. I experience it, and from your guys' stories, you do too.
And I felt like they weren't just looking at me as a breast cancer patient, but I felt like they really looked at me as a pregnant breast cancer patient. I really felt like it was tailored to me. When you're super scared and worried and just totally, in shock, that's something that feels really good, to just know that everyone's on it.
Yeah, and it's reassuring to know that people with different specialties are looking at this.
Yes.
I'm definitely thankful and grateful for the wonderful medical professionals here at St. Elizabeth. Harper and I would not be here without everyone taking that extra step to make sure that we were healthy. And this is the most incredible group of medical professionals, because they actually care about my family like we're their family, and incredibly grateful and thankful for that every single day.